This is my audience right here. My topic today is the subject on persuasive speech. And so, what we want to do today is want to give you a persuasive speech on the topic of to persuade my audience to develop ways in which we can incorporate them for an individual that has a infective liver disease, and it's critical for this individual to be placed on the transplant list. With a generous offer of donations and fundraising projects, we can, with certainty, defray the medical costs and the financial burden placed on the individual, and the financial burdens the emotional stress is placed on the individual in such a dire need of such a surgical operation. My topic includes the options that will defray medical costs, research of the requirements, and appealing to individuals for donations through fundraising events. Um, a liver transplant involves the surgical removal of a patient's diseased liver, and in order to replace it with another liver from a donor. Medically, this is referred to as OLT, or orthopedic liver transplant. The patient might either receive an entire liver or a portion of a donated liver, according to Dr. Griffin of the National Institute of Diabetic and Disease and Kidney Disease, the NIDDK. So, how do we become donors in the first place of a major organ? But basically, where we're going after we die, we won't need them. So it's important to cast your name as a donor while you're alive. Now, generally, before a person can be placed on the list, there are certain requirements that have to be met, according to the CDC, the Center for Disease Control in Atlanta, Georgia. First, you must undergo tests and evaluations and be diagnosed as an advanced liver disease, diagnosed with an advanced liver disease. And most centers and hospitals will also require that you be capable of paying for the surgery and accompanying treatment. Statistically, the National Center for Disease Control estimated in 1989 that the chronic liver disease ranked ninth among the frequent causes of death in the United States. So if a patient is deemed qualified, their name would be placed, added to a national waiting list. It's kept by the United Network for Organ Sharing. Such factors for a match includes a person's body size, their blood type, and the severity of their condition, which plays a huge role in determining when a person can receive a donated liver. The sickest persons are at the top of the waiting list. And typically, a donor would match a potential recipient based on certain factors such as body type, the APO blood type, the degree of health urgency, and the MELD, which stands for the Model for End-Stage Liver Disease score. So it's very critical that a patient that meets these critical needs be placed on a donor waiting list. And we cannot let doctors or the hospital or anyone else dictate this decision, because the sooner the patient that is placed on the list that meet these conditions, the better their chances are for survival. There are good sources of backup that you should have in place. One good source is your primary insurance, which basically should pay up to about 80% of the cost, the medical cost. Your second option is that you have some type of supplemental insurance, such as Medicaid or Medicare, that will cover the other half of the expenses. Other than that, you have to be prepared to pay for the surgical costs, and you have to be prepared to pay for the medical costs after surgery and aftercare. The patient placement on the national waiting list will only be secured when you have located a transplant hospital and you have guaranteed payment through insurance or other financial means, and you have been evaluated for eligibility and have received a physical referral. Which brings us to the point of raising money to meet the challenges and needs of medical expenses after surgery. Let me state the fact that the UNOS, the United Network for Organ Sharing, employs a computerized point system that ensures fair distribution of the organs. Recipients will be chosen based on primary and severity of the condition or health of their urgency, which is which each of the APO blood group on the list. So it's most considerate that individual fundraising can obtain the need and ease the financial burden. According to the Professional Guide of Fundraising, individuals give greatest amount of money to nonprofit organizations. Individual fundraising projects can greatly reduce the cost of medical expenses by raising money through the selling of products such as donuts or even hard chocolate candy bars. Establish fundraising events that gets the community involved as a whole. And there are financial coordinators at transplant centers that may be able to provide help with locating organizations that can contribute to your fundraising efforts. You may also want to appeal to large groups or organizations. What I would like to do right now is to appeal to my university, Liberty University, which is an accredited university, which which has over 60,000 students accredited. So I would ask that each individual on campus or online that have access to this video, that you please consider yourself as a donor to this cause, just as your leader, Jerry Falwell, has taught you to be a leader in helping others in need. So please donate, and we thank you, and God bless.